My name is Stacey Banks. I'm a research manager in the clinical trials office at the Inova Schar Cancer Institute. I joined the military when I was 17 years old. My mother had to sign my enlistment papers because I was too young to do it by myself at the time. So I went to basic training in South Carolina, did my medic training at Fort Sam Houston, Texas. Went on throughout the military, had an opportunity to participate in several humanitarian missions, both in the Caribbean and Central America. So one of the things I love about Inova is our mission. I love that we're a not-for-profit health system whose goal is just to provide the best health care we can and make a better life for people. That means a lot to me. I started out working for Inova for about 7 years. Did a brief stint somewhere else, but I came back because I loved the mission. I loved what Inova's doing. I love the fact that we care for so many people who don't have health care, who need to have free health care. We do so many things to help our community, and that means a lot to me. I would not want to go anyplace else that's just out to make a dollar, because that's not why we should provide health care and not what we should do in this industry. The reason I'm passionate about what I do in clinical research is just knowing that we are building the future of medicine. We have dozens and dozens of clinical trials that we do, and over my career I've probably been part of hundreds of clinical trials. I've been doing this for about 11 years now, is knowing that the patients who are volunteering now to be on these research studies, we're doing two things. We're one, offering them a new treatment, which hopefully is going to both give them hope and hopefully help them. We don't know for certain it will, that's why we call it research, but by doing that we're going to be able to help future patients. I think mostly my military service has helped me through knowing how to work with people of all types, knowing how to deal with emergency situations, how to deal with crisis situations, to stay calm, not to overreact, knowing how to follow protocols. That's a very big thing in the military, and it's also something we do in medicine to make sure that we follow our checklists, we treat the patients right, we've done all the right things we need to do. And that's really been the biggest thing, besides a lot of leadership aspects that have really helped me in my career at Inova.